The health sector in Nigeria is bedeviled with dearth of infrastructure, and personnel is not in doubt. Now, the level of intervention needed to bridge the gap is what is amiss. But according to a report on the outlook of Nigerian real estate market for 2021, the country needs more than 300 hospitals and 8,000 doctors to have standard health care for its citizens. Well, how far can the country go with this? Babajide, recently we have the doctors on strike. Right now the doctors are on strike, and there isn't any, we don't have any headway between the two parties involved, and we are having this report saying we need 300 hospitals for 8,000 doctors. How feasible?
If we had followed the health plan, the national health plan religiously, we will have more primary health centers, we will have general hospitals in each of the local governments, we will have in each of the primary health centers, we will have a medical doctor superintending affairs, supervising the nurses, the doctors, probably dentists, and other people. But what we have is, apart from Lagos and probably Rivers State, in most of our states, the primary health centers do not have medical doctors who are called MOH. Their duty is to supervise nurses and other junior people. We built those primary health centers and refused to ensure that there is someone of the level of a medical doctor who superintends the affairs. So if we look at the whole scenario, I don't think of all the 774 local governments in our country that we have up to 50 primary health centers with a doctor resident. You get the point that I'm making? And that's not so. You can imagine that's already a huge deficit. We are supposed to have 774 MOH personnel in each of the primary health centers. Now, even the primary health centers, we are not using them optimally for the purpose, yes, that they were designed. People suffer headache, they go straight to the tertiary health facility, because that is where you have a lot of consultants, senior people, specialists, and the rest. It is cases that can be handled at primary and secondary health facilities that should actually get up to tertiary, because the guys there are also supposed to be research fellows as well. But there's no time for research. There's no everyone. That is where people are. One of the big problems that we have, beyond the fact that doctors are leaving our country for other places, is the fact that we even have a problem of distribution of medical personnel. The rural centers of our country do not have enough medical personnel. And I'm talking about medical personnel across board, not just doctors, other categories of health workers. We don't have enough in the rural areas. Everyone wants to come to the urban center and end up at maybe Lut. Lut, for example, will have up to not less than 700 medical doctors. Whereas a good number of those 700 should actually be in the secondary and primary healthcare centers. Yes. And you look at an hospital like, what is it called in Ibadan? UCH. UCH will probably have up to 1,000 doctors working at UCH. how many of those guys are actually needed there. We need them more in the secondary health centers, like the general hospital, for example, because UCH is like a reference hospital. It's like a center of excellence. That's the way the national hospital was designed. It was supposed to be, the national hospital was designed to be a veritable center of excellence. But what we have today, somebody working inside his kitchen, he suffers a night court, they are taking him to national hospital. That was not what it was designed for. Because those guys should actually be concentrating on research and other things, but they have no time because they are busy attending to regular
knife cuts,
regular health. They are providing regular health care. That should not be their work. So beyond the fact that we don't have enough, the point that I'm making is that even the distribution, there is a big problem about the distribution of health personnel that we have in our country. Some of them should actually be in the
primary and health
secondary health centers.
But what do you take to have these ones, be distributed to these areas that are really of concern? Because I think some of the motivational factor you would say is they don't have that drive for them to be working in such places, or is it the facility, or is it that they don't have enough equipment?
It's the system has encouraged that kind of situation. For example, a general hospital should have no less than 25 medical doctors. So across board, 25 times 774. Can see that is that huge. It's huge because each of those doctors, if you have 5 departments, for example, let me just give an illustration. You have 5 departments. These 5 departments, headed by a very senior, maybe consultant, he also needs resident doctors to work with him. If he has his full repertoire of staff, definitely you have enough people for that level. What I'm saying, or the point I'm making is, at local government level, we don't have that number. Everyone is headed for the tertiary. It's at the tertiary level that you find when they are talking about people are talking about LUT, people are talking about UCH. We have relegated the primary and secondary health institutions and fail to provide their full complement of health workers. So I'm saying, I'm not arguing that we don't have enough doctors, but my point is that even the distribution is a problem.
Right. Now, BC, before we wrap up this segment, which is nearly coming to an end, we have the issue of the brain drain, which stares us in the face, and still we are lacking, in medical personnel as we speak. So what can we do now to bring, to grow our own, so that our health personnel doesn't leave the shores, and we have enough that could cater for the number of patients that arises on a daily basis?
Well, I don't know what we can do, except if we put the right things in place. I'm even wondering where this group got their 8,000 doctors figure from. Because as far back as 2014, there is a report that 8,000 Nigerian doctors were in the US alone. So, and I'm sure that between 2014 and 2021, more will have emigrated. So, and I also know that other countries are just taking our doctors anyhow. You see, the point is that people will continue to live, and it is unfortunate. It is unfortunate because we are not taking care of our doctors. We don't see these people as being integral, as being useful to us. And these other countries, they know the value. You see, to train a doctor in Britain, for example, an house officer, you need £256,000.
That's a lot.
Yes, and to train a consultant, you need over £500,000. And here, we train our doctors for like about maybe an average of 4 million naira. The federal government spends that money, and mind you, it is free. In federal-owned universities, they don't pay a dime, apart from the money that you pay for accommodation and all other stuff, maybe for practical and all of that. So Nigerian government is spending a huge amount of money training these doctors, and you now ask yourself, how do you invest so much in training and you allow these people to go and other people are just taking the advantage? Look, I think the way out, when I was looking at this topic, is that let us have a law in Nigeria where government officials, once they come to power, let it be compulsory that they will assess Nigerian medical facilities. When we have that law, you will notice that they will equip our hospitals, because they know that if they are sick, that is where they will go.
They are not even investing in health.
They are not investing in health.
In every political ward, there should be a primary health center. Every ward. That's the design. But we refuse to follow the design. I
know a nurse that left Nigeria because she works in a federal government facility. The key to oxygen is kept by one person, by an individual. And a lot, she was seeing people dying and she couldn't bear it. She has to relocate to UK.
Pathetic. But well, I understand we have a caller from Kaduna. Hassan, please go ahead before we wrap up the show. Hassan, can you hear me? Please go ahead with your contribution.
Yeah, my contribution is on the healthcare delivery. And I think we need more on the part of getting doctors, just as the madam said, and also on the part of supplies. We need much more than buildings. I think I have the experience of going around the healthcare in Kaduna State, and I've had the opportunity of going around, and I've seen buildings that were built during Sardauna. Those buildings, you find out that they are still in place and functional. Why? Because they've been renovated over time. And usually you find a health center in every ward in this country. Most times people, governors and local government chairmen don't improve such places and even make supplies for medications and the ventilators, you said. And other things that are very important in the hospital. But of course, we have a lot of doctors that are leaving. Let me tell you, sometimes it's not their fault. Sometimes it takes a very tough one to survive, even pay transport to the hospital, and while other countries are paying them a lot of millions. So you see, it takes a patriotic Nigerian to give that sacrifice and deliver in our health sector.
Right, and
course, we need to be on top of our game, and we need to improve that sector.
And that's a fine place to be with, Hassan.
The state, the local government, everybody needs to come together.
Absolutely.
And let's see that we improve and give our people a good health care.
Thank you very much, Hassan. Thank you for your contribution. And well, that's where we wrap up today's episode of Journalist Hangout. I'd like to thank my guest in the studio, Babajide Kolade Otitoju, as usual. Thank you very much for your insights. And Olabisi Deji Folutile, we appreciate your insights as well on the show.